Hi everyone, I'm Wahinya Doc. In this video, I'm going to discuss common cold, also known as rhinovirus infection. If you like this video and benefit from it, hit the like button, share, comment below, and most important, subscribe. What is common cold? Common cold is an acute viral infection of the upper respiratory tract. Upper respiratory tract consists of the following: your nose, your sinuses, your throat, and your voice box. Some patients develop 2 to 3 times common cold infection per year. These many are adults. Children can develop common cold infection around approximately around 6 times per year. What are the signs and symptoms of common cold? One, we have dryness of the dryness and irritation of the nose, sneezing, nasal blockage, runny nose, throat irritation, hoarseness of the voice, coughing, post-tussive vomiting occur as a result of persistent coughing. We have headache, we have fever, we have irritability, and we have feeling pressure around the face and the ear areas. And you can also lose the sense of taste and smell. What causes common cold? Common cold is caused by over 200 types of viruses, but 80% of the cases are due to rhinoviruses. Rhinoviruses are the most common cause of common cold, followed by coronaviruses. Then we have influenza viruses, and we have other viruses like adenoviruses. How are the viruses transmitted into your body? Infected persons with common cold will transmit or transfer the virus by blowing their noses, sneezing, and close physical contacts like shaking with the hands. When the viruses enter into your body, it attaches into the epithelium lining the respiratory tract. These are cells that line your upper respiratory tract. Then it will infect those cells. Your body will respond by producing cytokines to fight the virus. The effects of the cytokines is what will produce your signs and symptoms. What increases the risk and severity of common cold infection? One, we have exposure to someone who is infected. This will increase the risk of infection. Two, we have touching your eyes, your nose, your mouth through or with your infected fingers. Then we have overcrowding. Overcrowding will increase the chances and the rate of transmission of common cold. Overcrowding settings, we have the nurseries, we have daycare centers, and we have schools. Other risk factor is people who are too young or too old. These include children and old people because they have decreased immunity. And we have people with underlying chronic medical conditions like diabetes, HIV, and chronic diseases like of the kidney. These patients usually have low immunity and have high chances of getting infected with common cold and other infections. We also have smokers. Smokers generally have an increased risk of acquiring all respiratory tract infections. How is common cold treated? Common cold infections are mild and self-limited. Self-limited means that these infections can recover on their own without treatment. Complete recovery. can occur within 7 days in adolescents and in adults, and can also occur within 10 to 14 days for children. Medical treatment involve use of medications. Medical treatment usually focuses on relieving the signs and symptoms of common cold. We can use the foreign drugs. We have antihistamines. Antihistamines are drugs that relieve the symptoms of common cold and allergies. We have painkillers like Brufen, paracetamol. We also have oral decongestants and topical decongestants. We also have drugs like zinc, and also you can use saline drops. We have other supportive treatments. These include resting and taking a lot of fluids. Then you can position your mattresses at 45 degrees. And also, you can, for those who smoke and take alcohol, they should discontinue smoking. What are the complications of common cold if not treated? And for those patients who are immunocompromised or immunosuppressed, complications include sinusitis. Sinusitis is the infection of the sinuses. Your skull has sinuses, different type of sinuses. We'll make a topic of sinusitis in depth. Then we have a complication like otitis media. Otitis media is the infection of the middle ear. Middle ear is the space past the eardrum. Then we have chronic bronchitis. Chronic bronchitis is the problem with the bronchus. Then we have a worsening of asthma. Patients with asthma, when they get common cold infections, they usually have severe attacks of asthma. For more of this content, make sure you subscribe and follow Wahinya Doc in all social media platforms. Thank you.